Hi, I'm Bob Roth, Managing Partner and Co-Founder of Cypress HomeCare Solutions. Since 1994, we've been helping older adults in the Phoenix community age gracefully and safely in the place they call home. Since 2014, I've been bringing you Health Futures, Taking Stock in You, a show dedicated to helping you live a longer, healthier, and happier life. Be sure to subscribe, rate, and review this podcast and enjoy the show. Hi, my name is Bob Roth, and you are watching and listening to Health Futures. This is our first podcast that we're doing down at Pod Populi in Old Scottsdale. And today I am really blessed to have an incredible guest here with me. I am really excited to have Dr. Janna Assar. She is with Banner Health, and she is heading up their Banner Health concierge medicine practice. So without further ado, can I call you Janna?
Yeah, of course, Bob.
Janna, welcome to Health Futures.
Thanks, Bob, for having me.
It's so good to have you here in the studio with me, and certainly to do our first podcast for Health Futures.
I'm
You're
excited.
at Pod Populi, so
Thanks.
I would love to learn a little bit about you, and if you would indulge me and our listeners, tell me a little bit about you. Where are you from? How did you choose medicine?
Yeah.
And tell me a little bit more about Banner Health going into concierge medicine. And for our listeners, they may not know this. I had spent 10 years on the board of directors at Banner from 2008 to 2017, and I didn't know they had concierge medicine. So I'll let you take it from here.
Yeah, very new, innovative program, but I'm actually Canadian, born and raised in Calgary, Alberta, and then I came here for residency. So I finished residency at St. Joseph's Hospital. While I was a resident, I met my husband, who's a professor here in town, and started dating. So dated him through residency years, and we got married after residency. And after residency, actually, we were going to move back to California because that's where he's from. But then Sister Adele, I don't know if you know Sister Adele, but she is the founder and CEO of Circle the City, the nonprofit that takes care of the homeless population here in Phoenix, Arizona. She offered me the job of a lifetime to be medical director and, help her launch the outpatient units and the mobile clinics for Circle the City in 2015. And so it was an opportunity of a lifetime. I told my then fiance, this is what I went into medicine for. And I shook the nun's hand on the spot when she offered me the job. And I said, hey, I'm not going to California. I'm making Arizona home. So either you stick around here or we kind of go our own ways. And then he stuck around with me. And now we have a 2-year-old daughter. And
I saw a picture.
Kind of history.
She's adorable.
Yeah. So we're so excited. Being a mom is super fun and my best job. But after 5 years of being with Circle the City, this opportunity with Banner Health, I actually joined them probably a month before the pandemic started, actually, to start this venture.
Wow.
So I was offered the job February of 2020. And then I came over to Banner, and then we were in the pandemic. And so this concierge program and clinic they wanted to build out was kind of on the back burner. So I actually just helped them with pandemic efforts. So Banner Health was given the fairgrounds here. The fair is ongoing now.
Remember that, yeah.
And I was the ordering provider, sitting there every day, putting in the 3,000 orders for all the testing that was happening there daily. And then the vaccine rollout happened in December of 2020. So I was there again, putting all the vaccine orders in and doing that. And then finally, as the pandemic kind of slowed down, we started actually building the concierge program. And with our new CEO coming in, Amy Perry, she really wanted an executive health program arm as well. And so we built out those 2 arms. So I handle the concierge medicine arm, which is where patients are my patients, they pay an annual fee, and I'm their primary care physician and follow them throughout the year and years to come. And the other arm is really executive health, where companies come to us and I do their executive health physicals over a 1 to 2 day process. And they kind of go back to their own primary cares then and take all their data and testing that they had done with us back to their own docs to take care of them. So those are the two arms now that I get to handle for Banner Health. And it's been really exciting to see the program grow.
That's remarkable. So I know when the pandemic was, and we talked about 2020 and 2021. When did the executive program and concierge medicine start?
So really, we piloted kind of in 2022 then. Initially, we were out of Desert Ridge. There's a Banner Health location there. And so we piloted from there. But then the new Banner Health Arcadia Center Plus was being built on Camelback and 44th Street. And that building opened up early of the year in 2023. Wow. And we ended up moving then the practice and kind of launching full stream in August of 2023 there. And so that's where I'm located.
From Desert Ridge to that location.
To now we're we're in the same plaza as the Global Ambassador and JPP Morgan. JP Morgan. So it's a fun, exciting place. Very happening location. Very central.
So central to everything. 44th and Camelback is just perfect area.
And I live like a stone throws away. So it's kind of fun to drive to work and be closer.
Yeah. Not going out to all the way to Desert Ridge for sure.
Yeah.
So that's been really since 2023.
Yeah.
And, you've got a solid 2 years under your belt.
Yep. And we just brought in another provider. So he just started with us in July. His name is Dr. Jeffrey Curtis. And he's actually my attending. So I loved working with him when I was a resident at St. Joseph's Hospital.
Love that.
And I called him up and said, hey, do you want to come be my partner and run this clinic with me? And so he did. So he just started in July. And so he's about 3 months in now into the practice. And so we're really excited to have him on board.
It must really be satisfying to have that assistance because before it was all you.
Right. Yeah. And we did have another provider. Dr. Lauren Laster was actually hired with me in 2020 and then retired earlier this year. And so he kind of took his retirement and then I was kind of left alone again. So it's been really refreshing to have Dr. Jeffrey Curtis join me, who I really value. And I loved him as an attending. He was so great to work with, has taught me so much. I'm a great clinician, has sat on the IRB board for several years. And been involved with Creighton Medical School here. And so he brings a wealth of knowledge and acumen, and I'm so excited to work with him.
Going back to talking about working with Sister, what was her name?
Sister Adele.
And the homeless folks. I can't imagine how hard it was, but also how gratifying it was to be able to help them. And you saw everything.
Yeah. Oh, everything. I mean, I used to be on the mobile clinic. We used to drive that mobile clinic everywhere from Apache Junction to the West Valley. And now I'm really proud of the organization. I still follow them very closely and their mission. And I'm super involved all the time, as close as I can be. They're actually celebrating their 10-year anniversary coming up this year in 2025.
So you actually kicked it off.
So we were,
You were the original.
We were one of the original employees. Yeah. There was only a handful of us that started the organization there shortly in 2015. And now it's their 10-year anniversary of the outpatient Parsons Clinic and the mobile clinics. And now they have 4 mobile clinics. So one mobile clinic designated to each quadrant of the city.
The thing that I find remarkable is that, look, we go to doctors, and I'm talking about people in general, including myself, and we certainly are told by our doctors we need to do certain things. And you only can have so much control over that, right? You can say, hey, you need to lose a little bit of weight. You need to maybe eat a healthier diet. You need to move a little bit. Right. But how do we, and I don't mean to put you on the spot, but how do we make people accountable? And that's the hardest thing. And, I know, and we serve at Cypress HomeCare Solutions. We service the Medicaid population through Access. And I know that some of the health plans are authorizing community health workers. And having community health workers helps us make the patients and the people in our communities accountable for what their doctors are telling them.
Yeah. I mean, it's about getting patients motivated, right? When I was in the homeless world, housing was healthcare, right? If you don't have housing, people don't really even think about
So true.
and listen to you on what you have to say or your advice when it comes to their health, because it gets so far down on the totem pole. But I mean, now with the type of practice I have now, I really have motivated individuals who have the resources to kind of take care of themselves. I feel like it's definitely a different, spectrum of population that I deal with now, which is really exhilarating in itself. I get to really do those wellness principles and really follow patients very closely. I also think I get to spend, 1 to 2 hours with patients now. And so I don't really follow that same,
Right.
model of care where it's 15-minute visits, where it's very hard to even get their motivation, especially with the struggling population of the homeless, when in 15 minutes you're really just getting to their socioeconomic concerns, really.
Exactly.
Yeah.
Exactly. So different
Yeah.
in terms of the disparity between the
Yeah.
two. But like you said, I mean, you now are caring for people that have the resources and that can make those changes in their health.
Yeah, and I didn't realize how much philanthropy had to do in medicine. When I came to this side of the world, the philanthropic organizations that exist and, the monies we collect through the concierge service and that annual fee really actually go back, not to me, but to Banner Health as an organization to invest in the people of the community, right? And all that they do for Sophia and the general
Right.
public. So,
Oh, yeah. My days on the board, we would have a lot of fun at the end of the year because we would take those funds that you're talking about and distribute them out to not-for-profit areas and
Right.
areas that really needed the help.
Exactly. And so that's what I'm really excited that I get to be still part of that world too.
Right.
And that whole push from the side of philanthropy.
So you're now working obviously in concierge area and you're doing executive health as well. I'm going to ask you a couple times here on our show today, how do people find you and how do they learn more about this?
Yeah, if you go to Banner Health Concierge Medicine, were to Google it, and our website would pop up. You can find me there and just contact us. I initially do a meet and greet with a patient free of charge and kind of just a free consult and to see if it's a good fit. We give them a tour of the building,
Oh, I love
of
it.
the facility, get to see our space, kind of get to listen to how I practice medicine and my philosophy. And then if it's a good fit, then we kind of sign you up and, start with the first appointment, the initial appointment. So, yeah.
Jenna, I have so many more questions.
Yeah.
And I know we're just getting started, but we have to take a break now.
Sure.
So stick around.
Okay. I'm not going
Tell our
anywhere.
listeners to stick around.
Yes.
You're listening
please
to
do.
Health Futures, Taking Stock in You. We're going to take a break right now. Stick around. We'll be right back. We're back. Jenna, so great to have you here. So, I mean, concierge medicine, it's been around for a while. And there's lots of concierge practices here. I think for me, one of the things that, I was excited about getting you here in the studio with me, especially on my first podcast, is the fact that you have a health system, a rather large health system, the largest employer in our state that has decided to have this as a center of excellence. And for me, having been on the board for 10 years and a benefactor for a number of years, Banner has all these centers of excellence. They got the center of excellence with the partnership with MD Anderson with their cancer research and treatments. They also have a cardiac center of excellence, and they have one that is near and dear to me, and that's the Banner Alzheimer's Institute, which has now been around for, probably close to 20 years.
Yeah.
It's crazy what Banner's done, and they're trying to really have these centers of excellence and to have a center of excellence around primary care, because that's what we're really talking about in a
Right.
concierge form,
Right.
is very unique and interesting. So I want you to share with us a little bit about that.
Yeah.
And then, I always wonder what do those things cost and what is the commitment? How quickly can I get you? Are you
Yeah.
available at any time? So I'm throwing a lot of questions at you,
Yeah.
but
Let's
not
get
only
into
do
it.
I want to know, but our listeners want to know as well.
Yeah, absolutely. I think, when I joined Banner with this venture, even in 2020, I was really, it was really appealing because I could go ahead and open my own private concierge clinic, which a lot of those exist here in the Valley, or I could join Banner. And I kind of knew I wanted to go this route because I really wanted to do preventative care to the best of my ability and be excellent in it. And so, but Banner was like, it was a no-brainer really, because to have the entire network behind an individual is why I came to Banner.
Right.
When you're a Banner concierge patient, we have hospitals, urgent cares, a wealth of specialists, imaging, Banner imaging, pharmacies, phlebotomists, everything in-house really to take care of the patient. It's not really third-party sourcing
Right.
or, finding who's who in town for you and being in a wait queue. So that was, really why I came to Banner. I mean, and I think that's why our patients really love being a concierge patient with Banner, because they have the entire network behind them. And I have patients all the way from the East Valley to the West Valley who are my patients. And so we can find, Banner imaging close to them. They don't have to always come to my office to do it. We kind of find somewhere in the valley that's convenient for them, whether you're North Scottsdale or you're East West Valley or you're centrally located near me. There's a Banner imaging near you. There's Banner physical therapy near you. Our specialists are all over the valley. And so we kind of just use and call upon our own network for that. So that's why I think it's huge. The cost associated. So it is $5,500 annually to be a Banner concierge patient. And every family member after that is $4,000. I think it's a really small price to pay in a sense. We all spend a lot on healthcare, and anybody who joins, I know within the first 30 days of joining, always say it's the best money they've ever spent. Because once you join and you come in for your first appointment, which is usually about 2 hours long, we go.
Can you walk us through that? What does that look like, that first appointment?
Yeah.
To have 2 hours with you.
Yeah.
I mean, what can we talk about for 2 hours, right?
I really thought at first, like, what am I going to talk to patients about? Like, that can't be possible. Like a 2-hour appointment, I've never even seen that happen. But honestly, 2 hours goes by so fast for me and the patient. We go through their entire health history. I really do believe, medicine is a practice. It's an art of listening. And every patient is so unique, right? They know their own body best. And I really want to listen in and hone in on what they're feeling, what their symptoms are, why they're coming in, and what are their goals going forward. They're wanting to achieve what? And my job is to help them reach their goals, right? It wasn't until I became a mother 2 years ago that my own longevity came into perspective, right? Before I was a mother, I used to tell my husband, I have had a great life. If anything happens to me, just throw a great big party and celebrate my life and make sure there's good food. And then I became a mother.
Good food. I love that.
Right. And then I became a mother. And then I wasn't thinking about parties anymore. I was thinking about grandbabies I haven't even met yet. Right. And so my perspective changed. And then all I really cared about is I want to be that grandmother who's dancing on the dance floor, not supervising from a chair. And now that's all my research and all my passion is about, is longevity, right? Longevity to me is not about just lifespan, right? We know lifespan has increased for everyone, right? 50 years ago, people were only living till 65. Now we're living to 85 and beyond. But what about our health span, right? That's the most crucial part, is I want my patients, and for myself and my family, for that health span to be there, for them to have those decades of life of enjoyment in their later decades of life, not being crippled, right? And not being bound to a wheelchair, or not being able to go up the stairs, or not being able to get on the floor and play with your grandchildren. And so those are really my goals. And I feel like I share the same goals with my patients, and now kind of understand where they're coming from, and to kind of work towards those goals. So 2 hours goes by super fast now, and my appointments, I really enjoy them. We really get into the weeds about things and really work on the specifics, right?
I love how you framed it. Health span versus lifespan. And the fact of the matter is we are living longer.
Right.
I mean, I have a client that next month is going to be 108 years old. And and we've been doing this for a long time, 31 years. And I've been at the helm for 21 years. I've never had someone this old before.
Wow.
And she's amazing. I mean, she gets like 20 hours of care from us a week, and she lives home alone.
Oh my gosh.
I know, right? But, her quality of life is good. I mean, at 108, I mean, she does Wordle and she does New York Times crossword puzzle. I mean, these are things she does every day with her daughter, who's like almost 80.
Wow.
So,
that's incredible.
It's really interesting. And, for us, I mean, we are around people that are super aging, but how's the quality of their life?
Right.
And that's what you're really talking about. And when you sit down in those 2 hours, you're not only obviously checking all their vitals and going through their health history, you're also learning about who they are and what they are.
Yeah.
And we all have vices.
Yeah.
Hopefully they're sharing with you what those vices are.
Yeah.
And really I'm thinking you're putting a plan together, and it's a roadmap, not just as it relates to health, but it is lifestyle too.
Yep. It's so funny. Just yesterday, a patient came to see me again after follow-up, and he only joined with me in April of this year. And within the last 6 months, when he first came in, he admitted to me that he was drinking 2 liters of Mountain Dew every day.
2
and
liters.
He's a medical provider.
How old
Let
is
me
the guy?
say that. And he's about 62 years old.
Wow.
And has been drinking 2 liters of Mountain Dew every day. And yesterday when he came in and he said, you know what, Janna, I'm done. I've stopped drinking the dew, zero, nada, nothing in 6 months.
Wow.
And he's lost weight from just cutting out the Mountain Dew, feels better and healthier.
And he's a healthcare practitioner.
Wow. You think that sometimes us as medical providers, we've had a stressful life, getting through medical school, training, seeing patients and working the grind every day. I mean, I remember those days where I was eating junk food after residency. I'd pick up a Jack in the Box, before I went to bed. And so it's happened. We all, have eaten cafeteria food and not taken care of ourselves sometimes to the best of our abilities.
Right.
And it's time, there's a time where everybody thinks and then wants to put their health first. And I just hope it's not too late for people, because everybody's working the grind here in the country. We live in a sympathetic overdrive system here in America. And sometimes when I see patients, I mean, there are things that sometimes we can't reverse in time and go back in time, right? And without health, there is nothing else. And so, yes, you may have earned a lot of money, and I see big CEOs and big founders every single day who have worked lots of years and made a lot of money and made it big in life. But then if you don't have your health, what good is that money and what good is that time
100%.
Anymore? So
I know a few people that are no longer here that did all that. And for me, you talk about this healthcare practitioner who's 62. I share very freely on Health Futures about me. I just celebrated 63. And I got to tell you, I mean, for me, this was the first year where I really thought about how many more of these do I have? Mm-hmm. And I thought about the summer too. How many more summers do I have? Because we just came off a summer, and we all do work hard and we get immersed in our work.
Yeah.
But we really need to be thinking about us and how we are living our lives so we can live our best lives.
Yeah.
So, congratulations to your patient who answered the call and stepped up. I'm sure you told him, no more Mountain Dew and give up the dew. But that's just so important for us, is to really know that, we only have so many days left.
Yeah.
And for me, look, I say this very often. Friends come and go. Money comes and goes. Mm-hmm. But time is truly the only capital that we have control over. Mm-hmm. And how do you spend that time?
Right.
And who do you spend that with?
Absolutely.
And you want to spend time with those people that give you energy, that encourage you, that aren't there trying to suck the energy out of you. Yeah. And I think you can live the best life possible.
Absolutely. I worry that, since the pandemic, we've seen a lot of social isolation. We've seen less in-person socializing. And we know from blue zone theories around the world and our blue spots around the world, I mean, one of those criteria is really social interactions, right? People who stay social actually live longer and healthier lives. And so I really encourage people, to get back out and socialize, get with their friends, go on hike trails
I love it.
together, enjoy the outdoors now that it's looking cooler a little here. And hopefully after this rainfall this weekend, but to really get out there and enjoy the outdoors again and make the most of it.
So I'm so glad you brought that up. And as you know, Cypress HomeCare is the company my family and I founded. I've been at the helm now for 21 years. And, the biggest challenge I think we have is older adults and social isolation. 1/3 of our population in our community today, 65 and older, is solo aging. And in these communities that you see, and you see them all being built up.
Yeah.
You talked about Camelback. There's one just down the street called Clarendale. And we work really closely with them. Almost 70% are solo aging.
Yeah.
So, I mean, we have to figure this out. We need to figure out how we can get people together. I mean, look, babies get touched over 100 times a day. You shared with me about your little girl, and I'm sure your hands are all over her. But we have older adults that are sitting in their apartments or their place that they call home that don't get touched at all. Maybe once a week or once a month.
Yeah.
And we crave that as humans.
Oh,
we need the handshake.
Touch
we need
is
the hug.
crucial.
We need the little pat on the back. We're human, and that's how we're made.
Yeah. Well, if you come to see me, you know that I'm a big hugger and I hug all my patients and I'm super touchy-feely. That's just me as a person. And so I absolutely believe that. Yeah. I hope that, one of my goals is to take my daughter to all these senior living facilities and have her, meet and have fun with these seniors, right? Because that's what they love, is seeing babies and having that spirit and that running around and getting that touch and that love and affection. And so it's so crucial, so crucial.
It's a great segue for me, because when we come back, I know we're going to be up against a break here shortly, is really talking about where do we see the future. And, for me, one of the biggest challenges we have is that when you look at the data, and I'm sure you've looked at it like I have. I mean, I grew up a long time ago before you. But when I grew up, it was population explosion. We were worried about the resources, suburbs were being built, all these new rooftops were going up, schools were being built, churches were being built, synagogues were being built. You name it, it was just growing outside of these cities. And then all of a sudden, here we are, we're a shrinking population. We have 345 million Americans. In order to sustain this population, we need every child rearing female to have 2.1 kids. So you're going to have another one, Jenna. But I mean, that's how we're going to keep up with this population.
Yeah.
And we're at 1.63 and declining. So how do we do this? And I really believe something you just touched on is really the secret sauce to the future. And I know a lot of cultures already get this. And, I'm here today to tell you that we're around 31 years. And we have a lot of Hispanics that live here in our community. And we have Hispanics that work for us. About 20% of our workforce is Hispanic. Yeah. I can't name on two hands how many Hispanic clients I've had in 21 years. And why is that? It's not because they couldn't afford our services. It's because they care for their own. Right. And I really see us as a country migrating back into that fold, right? Migrating back into that nuclear family where you've got adult children and you've got family. Like my mother, when she grew up, her aunties and uncles and cousins all lived on the same block or the block next door.
Absolutely.
Well, we're going to take a break right now. You're listening to Health Futures, Taking Stock in You. We're down to, we got one more to go. I'm looking forward to finishing up. So we'll be right back. Okay, we're back. Jenna, we were talking about the future. Obviously, I gave really kind of the Bob Roth view of the future, really talking about going back to these nuclear families. But I want to really dig into the practice that you do. And, one of the things that, you've talked about is prevention. And, how do we expand lifespan and still keep health span. And, there's a lot of technology out there. I mean, I'm wearing a wearable. There's ambient technologies that are out there. I've seen some really cool things.
Yeah.
Please share with me some of the things that you are practicing or leaning in on as it relates to preventatives.
Yeah, I think we're, on the brink of incredible advancements in medicine, right? Multi-cancer detection blood tests are almost getting FDA approval right now. We're excited about those. What about Alzheimer's blood tests?
Oh, I know.
mean, that is
Dr.
not
Eric
science
Ryman's
fiction.
been working on
You
that
know
for a
that.
long time,
Yeah.
and they're here.
Yeah.
It's here. It's so
Dr.
cool.
Nick Ashton is now with Banner Health. We're super happy. He's written multiple publications and is on the forefront of the blood test for Alzheimer's disease. And it's actually, you can order it today, right? To find out your risk today and maybe be able to act decades earlier is huge.
100%.
So
knowledge is power.
Oh,
and
absolutely.
if you have that knowledge, you can do things.
Absolutely. And advancements right now are huge. So cancer detection test, the blood test for Alzheimer's. I mean, cardiac testing is getting more detailed, more specific day by day right now. We can tell from a cardiac scan without even an angiogram whether you have soft plaque versus hard plaque, right? And hard plaque is stabilized plaque, right? It's plaque that doesn't kind of dislodge and cause a heart attack, but soft plaque is what we care about. And we can tell, do you have soft plaque or not? And, a calcium cardiac CT scan, right? I had a patient the other day, calcium cardiac CT score of over 2,000.
Whoa.
I mean, that is astronomical, right?
Maybe still walking around.
Right, still walking around. And a ticking time bomb, right? So we can catch heart disease before the heart attack even now these days.
Still the number one killer.
Yeah.
Hearts.
Yeah, and exactly. I've seen, when I order this preventative testing and take that deep dive, even into that patient who we were talking about earlier about the Mountain Dew, I had ordered him a carotid ultrasound, right? Generally, I order a carotid ultrasound on all my patients that come in as preventative care.
Mm-hmm.
And he had almost greater than 90% stenosis on his right side.
Whoa.
And then he goes in to get that stenosis fixed, and they found a dissection of his carotid artery. So he almost could have died at any time, and he needed stents placed in his carotid artery and got the stents placed. I mean, it was like life-saving.
Timing's everything. Right?
Timing is everything. And honestly, you think you have nothing, but prevention is everything. I mean, to save somebody's life like that and ordering preventative testing has been remarkable, I think. And physicians can do that too right now. It's about having the time and the abilities to order those testing and having the resources to be able to get them done. So I think it's huge. I mean, what medicine is going to be 5 years from now is going to be totally different. I mean, with AI and all the wearables and all the technology coming down the stream, it's huge. I mean, I in my office have an AI app that records my visit so it can dictate my note, so I don't have to have my computer on and I'm not typing away while you're talking to me. I am giving you my full attention.
Oh yeah.
And it's completely you and me, like eyes to eyes, I
love hearing
patients love that. I love that. Providers love that, right? We want that. We do not want to be like typing like mad people and trying to dictate our notes while we talk to you. That's not what we went into medicine for. And so I think a lot of great things are going to come with technology, and we just have to embrace them. And it's going to make medicine and healthcare better.
I love hearing that you're doing that because, healthcare's always been lagging in tech.
Yeah.
They always have.
Yeah.
I mean, before the pandemic, I think there were like 20%, maybe at the most 30% using telehealth.
Right.
I mean, and it was been around for a while.
Yeah.
And then because of the pandemic,
boom,
everyone is. And now you got over 70% adoption. And it makes sense for a lot of the older adults. I mean, I shared with you for a 108-year-old, almost 108-year-old. You know what it takes to get her up and go to a doctor's practice?
Yeah.
I mean, if we could do a telehealth visit,
right.
I don't know what medication she's on, but if she's on like Coumadin or something like that, we can order those labs.
Right.
They can come to the home.
Yeah.
She doesn't have to go to,
Yeah.
one of the places to go get the labs drawn. She
Yeah.
can get that done at home. And I think the advancements are great. I love what you're doing with AI because we're doing that in our practice too. I mean, it makes sense to let AI and machine learning to do workflow stuff so that we can be more relational and intentional and authentic with the clients that we serve.
Yeah.
In your case, the patients.
Yeah. More present.
There's nothing worse than having your head down, typing or writing something.
The worst.
You're not paying attention.
Mm-hmm.
So this way you can be fully engaged. And,
Yeah.
and then the great thing what AI can do is they can put a whole summary together of that visit.
Yeah.
And
super nice.
You can look at the 16 pages
Mm-hmm.
or you can look at the one page.
Yeah.
And if you see something that catches your eye, you can drill down and
Right.
get to the actual conversation.
Yeah.
And
I love it.
and
So I'm not
examine
doing
that.
homework at home, I didn't become a school teacher because I didn't want to grade papers. And then I went home and did charting all evening and weekends. And that's what most docs do, right? So this really frees up our time so we can enjoy work-life balance too, and have that with our families.
But you also, the other thing that you guys can do, and say you guys, physicians and doctors, is there's always these new breakthroughs.
Mm-hmm.
So how can you learn when you're going home and charting and documenting when, you could be doing some learning about the new breakthroughs that are happening in dementia and Alzheimer's and Parkinson's and all these areas.
Exactly. We don't even have time. Most providers don't have time to even read the many journal articles that come out every day and the advancements every day that's happening because we're so busy charting. So this really frees up our time to enjoy medicine again, I think, and really get into it and keep up with our medical knowledge.
So, I want to go back to your concierge practice.
Yeah.
So your concierge practice, you gave us the amounts that you pay.
Mm-hmm.
I asked you at the break, you bill the insurance company for all the diagnostic stuff and labs that you do.
Right, exactly. When you see me, you're paying that annual fee and basically you have 24/7 access to me. You have my cell phone in your back pocket. It's like having a doc in the family.
A doc in your pocket.
Right. And so people love that. And you can reach me anytime. But anytime I do see you in the office or I order imaging or any studies or lab tests, it just gets billed to your insurance. Yep. And then you can always use HSA, FSA as you would for medical payments and billing, as they kind of allow you to. What plan you have.
I think the really cool thing, and I'm sharing this with you because I know this and sharing it with our audience too, is that getting in to see a specialist is not an easy thing.
Yeah.
So if you have a primary care and you need to go see a nephrologist or you need to see a urologist or cardiologist, you typically have to wait.
Right.
And that wait could be a month, it could be 2, sometimes 3 months.
Yeah.
I'm making the assumption that if you're a part of the Banner Health concierge system, you kind of go to the front of the line, don't you?
So you do in some respect, but again, we try to prioritize need with patients. So again, I'm not going to bump you up for somebody who's more cardiac severe,
of course,
in a situation. But we do try to do the best we can, and also use a lot of the partners. Whoever has first availability, if there's a cancellation, to get you in as soon as possible. I have a designated nurse navigator to the clinic. So she's wonderful. Her name's Nancy, and she's been with me from the start. And so she really helps navigate my patients through the system because we all know navigating healthcare is not easy. Even for my own family, to get appointments, to navigate and get appointments with either imaging or something to be done or a study or that lab test, or if you want a home lab draw, right? Having that being done, Nancy kind of helps facilitate all of that and how they move through the healthcare journey kind of and the process of all my orders and what I want done or who I want them to see. So she is instrumental. And so helping navigate your kind of healthcare, and you have access to Nancy as well and me. And we kind of dual team it and take care of you.
So we talked about early on, I think it was in our first segment, we talked about accountability. So I'm curious, how do you hold your patients accountable? Is Nancy involved in that? Are you involved in that? I mean, obviously you saw Mountain Dew Man.
Right.
He came in, but A typical, you go see your PCP, they tell you what you need to do, and then you come back a year later and they're like, you're the same person. Right. How do you make them accountable?
Yeah. So what I really love about our Banner Concierge program and the Executive Health program is actually this is a joint venture with a group called Castle Connolly, who's out of the East Coast. And Castle Connolly is the group that comes out with the Top Docs magazine every year. If you've seen that on shelves.
Yes, I have.
Castle Connolly is behind that. And what they bring to the table with this joint venture with Banner Health is actually they have esteemed licensed health coaches that are part of our concierge medicine team. And so if you're a member with concierge medicine at Banner Health, you have a designated health coach. Ooh. And it was that health coach, honestly, that helped me with Mountain Dew Man and helped helped him. Yeah. And helped him get off the dew. Right. And she was instrumental in that. Like, I believe in health coaches, especially licensed ones who can really be beneficial. And these health coaches have helped me make those strides with patients. I've helped patients quit smoking, change their lifestyle, drop weight, get exercising, teaching them exercise plans, teaching them how to read nutrition labels, food, cleaning up their diet, whatever it is. They're huge. So they really focus on what they call the SENS program, SENS, on sleep, exercise, nutrition, and stress management. That's kind of their philosophy. And they're huge. So I love that about the membership is that you have not only myself, Nancy as the nurse navigator, but also a health coach at your disposal.
Well, I love that.
Yeah.
I'm so glad I asked that question.
Yeah, I'm glad you went back to that too.
So, we're getting ready to wrap up our show. We got a few minutes here. Yeah. Is there a question I haven't asked or some thoughts you would like to leave, just not me, but our listeners?
Yeah, I think when it comes to longevity, and that health span we were talking about again, it's just important to have somebody take that deep dive with you, right? I think there are so many questions that come up from patients, right? What supplements to take? What really matters? What is the cutting research and what is the research showing today on these supplements, right? Is this a fad? Is it not? Is it evidence-based? Is it not? And some things can be harmful, right? People can be taking some supplements that could be harmful to them, could interact with their medications. And so I think there's a lot of, media out there and a lot of false information. I think having somebody really sit down with you and cut through the noise to see what's real and what's going to help you reach the goals that you want is super important for that health span.
No, I love that.
Yeah.
So, as we get ready to wrap up, you did a Fox News thing earlier this month.
Oh, yeah.
Earlier this week. Yeah. It's Sober Month, October.
Yeah, it's Sober October.
So Sober October, I would love to get your views on alcohol because, I'm reading all kinds of stuff. I mean, look, we're all drinking from a fire hose.
Yep.
And AIs will really open up the door.
Yeah.
And, we heard years ago red wine was really good. So everybody said, okay, I'll just drink a lot of red wine.
Right.
But now I'm hearing like no alcohol.
No,
you shouldn't be drinking alcohol.
Yeah.
Is it really something we should be cutting out of our diets as Americans?
It's really real. And I'm sad that it took us this long to find out the dose-related relationship that alcohol has with cancer, like we did for smoking. But it's real, right? The end point is that alcohol causes cancer, period. And we've seen from the research and the meta-analysis that has been done from all the studies from 1956 to 2012 now that, even one standard drink can increase a woman's risk for breast cancer by 4%.
Wow.
And more than 3 drinks, more than 3 to 4 drinks could increase your risk of liver and colorectal cancer if you're doing 3 to 4 drinks a day. And the real cancers that we saw an increase with the research was really oral cancer, esophageal cancer, larynx, pharynx cancer, as well as colorectal cancer, liver, and female breast cancer. So the research is really real now. And I'm, this All Sober October actually started in the UK to help fund research for cancer. And I'm really happy it has. And I'm really glad the whole globe is kind of taking it over. And we're seeing a lot of millennials and honestly, Gen Zers are the ones who are doing more non-alcoholic drinks, right? It's becoming like the mocktails are becoming popular. And so I really kudos to them. I think, wasted is out and wellness is in.
Wasted is out, wellness is in.
Yeah.
I love that.
And so I'm really excited that the young population is actually trending this. And I'm hoping that baby boomers kind of followed their trend.
So for our listeners, no alcohol, not even a glass.
Yeah, not even a glass.
I'm sure you've had some alcohol in your past.
Oh yeah.
So are you no alcohol free now?
I probably do. I probably do 1 drink a month here. Okay. I was never a big drinker anyways. Right. And so, socially, I think if you're going to do 1 drink a month or something, that's fine. But if you were to really quit over 30 days or 31 days, I feel like a lot of people start to feel better, right? They start to sleep better. Right. They don't feel hungover anymore. They're pooping better. Maybe their GI system is better, their memory is better, they're sharper, they're more focused, they're more attentive. And then they're like, do I really need this, right? And that 30-day could be a jump start into a whole new habit. So of just quitting alcohol altogether. So,
well, I'll tell you what, sage advice, and it's some advice that I'm going to take, and I hope our listeners take this as well.
Yeah.
So, Dr. Janna Assar, how do people find you as we close out our show?
Yeah, please go to the Banner Health Concierge Medicine website. If you just put that into Google, you'll find me. We'd love to see you at our office and give you a tour and sit down with you and see if this is a good fit.
Well, I love having you on.
Thanks,
and
Bob.
Hopefully our listeners are listening and we'll be lighting up your phones and having people make appointments.
Well, I'm great. Thanks for having me, Bob. It's been great being here.
It's been great having you.
Thanks.
Thank you for listening and watching Health Futures. Make it a great day. Have a great weekend, and we'll be back next week.
Thanks for listening to Health Futures, Taking Stock in You. I'm Bob Roth, reminding you that living well isn't just about years, it's about the quality of life and connections. Follow and share the show, and join us next time for more on how to live a longer, healthier, and happier life.